Salt Jan is off tonight. The next time you sit down to dinner, you may want to pass on passing the salt around.
A new study by the Heart and Stroke Foundation reveals that 1 million Canadians could eliminate high blood pressure by cutting their salt intake in half.
I don't think it's appreciated the effect that salt has on blood pressure, especially as we get older or we get heavier. Then the salt that we take in has an increasingly significant effect to move up blood pressure.
1 out of every 5 Canadians has high blood pressure, but more than half of them don't even know they suffer from the #1 risk factor for stroke and heart disease.
Roughly 80% of the sodium we consume comes from either food in restaurants or processed foods. Salad dressings, mayo, ketchup, they are just packed with sodium. So making your own dressings and cutting back on condiments can really help lower your salt intake. And when you pick up something like a can of soup, you want to check the label and make sure that one serving doesn't have any more than 480 milligrams of sodium.
Just from the salt we take in processed foods, we get about 30% more than we need. And that's before anybody picks up a salt shaker.
The study published in the May issue of the Canadian Journal of Cardiology also says cutting down on salt could severely cut health costs.
High blood pressure is really expensive in the medical system. We're talking about the #1 or the #2 cause of premature death in Canada.
The study says $430 million could be saved a year on fewer physician visits, lab tests, and lower medication use.
Dr. Feldman also says small changes can make the greatest of differences. Small decreases in blood pressure from either exercise or diet can reduce the risk of heart attacks by 50%.